Are you actually vitamin D deficient? Your blood test comes back and one line is highlighted in the app. Vitamin D low, and just like that, you're deficient. Maybe a friend swears by it. Maybe a shop assistant is already reaching for the big bottle. But before you panic or commit to a year of pills, let's ask a sharper question: low compared to what? Because the honest answer is more interesting and a lot less scary than the highlight makes it look. First, the why. Vitamin D behaves more like a hormone than a traditional vitamin. It's something your skin makes when sunlight lands on it. Its main job is quiet but important. It helps your gut absorb calcium, which keeps your bones and muscles strong. When it's genuinely deeply low for a long time, that's a real problem: soft, painful bones in adults and a bone disease called rickets in children. So this matters. Hold on to that, because the rest of this video is about telling real trouble apart from a scary-looking line on a report. Here's where the confusion begins. The test measures a storage form of vitamin D in your blood. The catch is the cutoff, the line between fine and low, and two respected groups drew it in different places. The national academies who set nutrition standards said a level of about 20 is enough to meet the needs of nearly all healthy people. But an older expert guideline pushed for 30. Many labs printed 30 on the report. So if your level lands in the 20s, the app flags you as insufficient, even though by the national standard you're actually fine. So who's right? That gap between 20 and 30 is the whole story. It's the difference between millions of people being deficient or perfectly normal, depending on which line you use. And here's the part most headlines missed. In 2024, the Endocrine Society updated its guidance and no longer recommended aiming for a routine level above 30 in healthy adults. They acknowledged that the science doesn't actually pin down one magic level to chase. Which leads to a surprising question: should a healthy person even be tested at all? The major prevention task forces say not routinely. No big health body recommends screening every healthy adult for vitamin D. The reason is humbling. In large trials, including one that followed thousands of people for years, giving vitamin D to people who weren't truly deficient didn't consistently lower their risk of heart disease, cancer, fractures, or falls. So a low flag on a routine panel in someone who feels well often doesn't change a single thing you should do. Now, don't swing too far the other way. This is not vitamin D doesn't matter. Genuinely severe, prolonged deficiency does cause trouble: aching bones, weak muscles, and over years, fragile bones that break more easily. The point isn't that deficiency is fake. The point is simpler, and it's the heart of today's video. Being flagged on a lab is not the same as being deficient in your body. So who actually needs to pay attention? Picture the people who don't get much vitamin D the natural way. Those who get very little sun, indoors most of the day, fully covered up, or living through long dark winters. Older adults whose skin makes less of it. People with darker skin which needs more sun for the same amount. Babies who are only breastfed. People living with obesity or after weight loss surgery. And anyone with a gut condition that blocks fat absorption, like celiac or Crohn's. Some medicines matter too. Certain anti-seizure drugs and long-term steroids can increase the risk of deficiency. And in countries like India, where darker skin, indoor lifestyles, clothing habits, air pollution, and limited food fortification are common, more people genuinely fall into the higher risk groups. If you're on that list, vitamin D is genuinely worth a thought. What does real deficiency feel like? Often nothing. Many people with mild or moderate low levels have no symptoms at all. Real symptoms tend to show up only when it's been low and deep for a while. A deep ache in the bones, muscles that tire easily, a heavy fatigue. But notice those signs are vague and 100 other things cause them too. So please don't diagnose yourself from tiredness alone. That's exactly the moment to talk to a doctor who can decide if a test even makes sense. Here's the freeing part. You don't need a perfect number to do the sensible thing. For most adults, the recommended amount is about 600 units a day, 800 if you're over 70. Sunlight helps many people make enough vitamin D, though that varies with your skin tone, the season, and where you live, so food like oily fish, eggs, and fortified milk helps too, and if you fall short, a small daily supplement closes the gap. It's cheap, it's safe, and it quietly covers your bases, no lab required. There are people who should be more deliberate though. That same 2024 guidance pointed to groups who may benefit from routine supplementation without any testing at all. Young children, people who are pregnant, adults over 75, and people with prediabetes. And if you're in one of those at-risk groups we mentioned, or you actually have bone or muscle symptoms, that's a real reason to test and, if needed, treat. With your doctor, not a search bar. And one more twist, because actually cuts both ways. More is not better. Mega doses don't buy extra health, and very high levels can backfire, too much calcium in the blood. In fact, some studies found that intermittent high-dose vitamin D actually increased falls, not reduced them. Here's the reassuring half: you cannot overdose from sunshine, your skin simply stops. Toxicity comes from pills, so those giant weekly mega doses from the internet aren't a free win. Sometimes they're the actual risk. So, are you actually vitamin D deficient? If you feel well and you're not in a high-risk group, probably not in any way that needs a test or a worry, just the everyday basics. If you are high risk or you have real symptoms, that's a genuine conversation worth having. Either way, remember the line that runs through all of this. A number on a screen is information, not a verdict. If you'd like the simple version to keep, comment the word honest below and we'll send you our one-page vitamin D cheat sheet, who's actually at risk, what the real cutoffs mean, how much to aim for, and when a test is worth it. At Sushruti, we'd always rather hand you the why than hand you a fear. So if that's your kind of health channel, come along and we'll keep things clear, calm, and worth knowing. No fear, just the why. This video is general information to help you ask better questions, not medical advice and not a substitute for your own doctor. If you take medication, are pregnant, or live with a health condition, your needs may be different, so check with a professional before making changes.